Welcome to the Daily Briefing on KLAM and KCDV. We start the 19th week of Cordova's response. It's Monday, July 13th. And these programs come to you in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio. And, of course, are archived, as always, to youtube.com/Cordova TV. We're going to use today's program to review a little bit. Obviously, last week came off of a tough week with what for Cordova certainly was a substantial rise in case counts. A lot of our experts are focusing on the coming week ahead, the mayor, the public information officer, our local doctors, and so forth. So we'll take an opportunity today to just sort of review with an important voice in Alaska's overall COVID response, and we'll hear what Dr. Zink had to tell us last week in case you missed that or would enjoy a refresher. Hers is always a good voice to be heard in the middle of all of this. So you'll hear the couple of questions we were able to ask her last week, and then we'll come back with a review of how Cordovans can be responding, sort of regardless whether the numbers are growing or staying flat. The response for folks is largely the same. So that's the plan here, and again, we'll go back and review what Dr. Zink had to tell us as our case counts were beginning to rise, starting out with the concept of contact tracing and why that's important. Contact tracing comes up a lot. So could you talk a little bit about how that works? What are the steps that you go through to make that effective?
Yeah, no, I appreciate that question, and I just really appreciate the community of Cordova. I feel like since the beginning, kind of really stepping into the challenges of this virus and finding out new and creative ways to respond to it. And I'm really sorry to hear that you guys have had these cases. It's just no fun at all, and something that we are trying to always keep at bay. When we do identify a case, we work closely with the local authorities and the healthcare providers. Sometimes they know first, sometimes we know first. It just depends on how the lab tests are resulted. And then we have kind of a triage process. And so the cases then get assigned both to an epidemiologist as well as someone within our public health nursing team. There's a couple of different things that we're trying to get out of contact tracing. The biggest thing that we're trying to figure out from contact tracing is when that person became infectious and who they might have been in contact with them. And that can be sometimes a difficult thing to look at. And the main thing we're looking at is the earliest onset of their symptoms. And then what we do is we go 2 days back from the earliest onset of their symptoms because that is when they are most infectious. And then from the time forward. So if someone, say, I'll just pick a random date, July 1st became symptomatic, we would look 2 days prior to that and look for anyone they had spent more than 15 minutes within 6 feet of. And those would be determined close contacts. And those people we would recommend to quarantine for 14 days during that incubation period from the last time they were in contact with that individual. There's another process that happens at the same time where we're going back not just for the 2 days in the infectious period, but looking 14 days back. And that's more to try to figure out how they might have gotten the disease to see if we can kind of link different cases together. But that's a very different question than we're trying to answer on that infectious period. I think the thing to remember about contact tracing is it's very helpful, and it can help us to figure out exactly who is connected where. It can take a bit of time, but I also think about it a little bit like your flashlight at your feet or maybe slightly behind you rather than ahead of you. This can be helpful to minimize other cases, but it's not looking forward. It's trying to prevent future ones, but that's why it's so important that we're wearing masks, staying 6 feet apart, and not just thinking about the person who had it or the person who had been identified or the location where they had gotten it, but really realizing that while that may have been identified, that may not be the person who is currently actively infectious, and why we all have to do our part to minimize the spread of COVID looking forward. So they're both important tools, and that is the process that we use.
Well, and you raise a really good point, too. Obviously, there's a tendency to fear who's infected and how did they get infected and who was around them. And if you focus too much energy there, you could end up, showing a lot of caution in one area and throwing caution to the wind in other areas. And it may be something or some situation completely unrelated to the identified case that could cause you to get it, right?
Yeah, you're exactly right. Depending on the location and the testing and turnaround time, and also just the incubation period, oftentimes these cases represent something that happened a week or more ago. because it takes a while for people to develop symptoms, and then they have to get tested, and then we have to get the test results back. And so therefore, a lot of this contact tracing is looking in reverse, and we need to realize that the risky location or the person who might have it may be someone who yet isn't identified or detected. And they may be someone who doesn't even have symptoms yet. It may be you, it may be me. And that's part of the reason that this disease has been so hard to get under control and why it really takes all of us stepping into this space to help minimize the spread of COVID.
Well, I mean, you've seen the virus appear in communities. You've been through a number of communities where it starts and then it grows a little, and then some places have outbreaks, others don't. You know, in observing the different towns that are in the phase that we're in, where maybe community spread is just beginning to start, what would you say are the key things that you can take from seeing what's happened in all these other towns and provide to us as advice?
Yeah, no, that's another great question. I think Cordova is just in a unique and very important time kind of with these early community cases, because this is the time to get this under control. I think that the biggest thing that people can do is be kind, that to not isolate, not to criticize, not to shame, but realize this takes all of us working together to remain calm, to remember that this disease only spreads if we let it. It only spreads if we get within 6 feet of each other, not wearing our masks and not washing our hands and touching surfaces. If we all just hunkered down for 2 weeks and didn't see anyone else, it would just stop. It has to have another host to be able to live in, or it dies out. We are in complete control of this virus if we're willing to step into that challenging space and do it. And we've seen communities across Alaska do that. I think Fairbanks is a great example from the beginning that had really a lot of initial cases with very significant concerning spread early on. They stepped into that space and they went almost a month with no cases in their community. Unfortunately, they're starting to get some now, and that it speaks to us continuing to need to be vigilant. But Alaskans across the state, we've seen this across the world, that if we're willing to work together, do these things to be able to really minimize the disease, we're able to get it under control quickly. But it's much easier to do right where you're at now, right at the beginning, than when it becomes much more spread. So this is the time to really see if you can get it under control and get rid of the spread and transmission, and be able to get back to Cordova before, when you weren't having community cases. And based on the things that I've experienced and seen from your community in the past, I have no doubt that you guys will step into that space. It's been just tremendously inspiring to see what you've been doing.
Okay, those comments came back on July 9th. We're back here now July 13th with the current briefing. And again, a thanks to Dr. Zink for being available. There's still a chance I might be able to do a little bit longer visit with her in the near future. But tonight, I think there's another briefing with the governor and staff, so I'm sure she's going to be pretty busy getting ready for that. To complete our review here now, to kind of reset us after the weekend for moving ahead, let's go over quickly this announcement that came out from the city as the case count was beginning to rise. It said city leaders acknowledged the increase of positive COVID-19 cases and that raises concern about further community spread. As a precaution, residents and visitors are strongly encouraged to heighten their compliance with the following recommended health precautions. Maintain a 6-foot distance from others, even when you're wearing a mask. Shrink your social bubble by limiting interactions with those outside of the immediate family or friend group. Wear a mask that covers your nose and mouth when in public or around others outside the immediate family where social distancing is not possible. And remember, wearing a mask in public is mandated by the city. Wash hands often for at least 20 seconds and sanitize frequently touched surfaces. City Manager Helen Howarth said, quote, "Because the virus can be spread unknowingly by asymptomatic individuals, we have to step up our precautions. We owe it to our family, friends, and neighbors. Through our individual action, we have the power to control the spread of COVID-19 in the community." And so with that review, we wish you the best for this Monday the 13th. Daily briefings again on the Clam and the Eagle in the 1 p.m., 5 p.m., and 8 p.m. hours. And then archived to our YouTube channel, youtube.com/Cordova TV. Hope everybody's able to be safe, and we'll look forward to seeing you for the next briefing tomorrow. In the meantime, back to the music on the Clam and the Eagle.